Hello, this is Mark Sonomoser with COVID Navigators. We want to give you a brief education on donning and doffing for persons under investigation and or who've been diagnosed positive for COVID-19. At the beginning, I want to go ahead and thank Christy on 5 East for being our main actor in this presentation. To begin with, you want to make sure you have all your PPE on hand. At a minimum, those are gowns, face shield or goggles, N95 respirators and or PAPRs. A lot more PAPRs are being used. A pair of exam gloves. If you can get the extended cuff variety that go over the wrist, that's great. Consider a couple pair of exam gloves if the patient has a lot of respiratory secretions and or body fluids. Outside the room, you want to have that isolation cart if you can to organize all your PPE, a large trash can for doffing, and then appropriate signage. Signs for both contact and airborne isolation, and then a large stop sign for those people who don't understand isolation precautions, such as visitors. There's another kind of sign, the room cleaning signage, and these are for patients who were positive, tested COVID while they were in the room, or if they're transferred out before the not detected or negative results come back. So both these categories of patients, you would have to do a COVID clean on the room, or environmental services would. And so you'd put a sign up which basically told people when the room could be used again. Inside the chart, you want to have that isolation order for airborne and contact isolation, and then also the accompanied plans of care. Make sure there's a COVID test ordered. Um, Most of the time, this is not a problem. The providers take care of it, but I find it's occasionally missed. If there's not a test ordered, check and make sure if they had testing done prior to coming to Mosaic. This could have been done at an outside Mosaic facility, or it could have been done at another hospital, or even, say, from a nursing facility. If it's done outside Mosaic somewhere, just make sure there's clear communication on how you're going to get results. We usually involve infection control in this by calling them at 6605. If you have that positive COVID patient, you're going to have a dedicated observer, and their job is mainly to watch you don and doff, and they'll be using a checklist while they do this. Begin with the basics, and that's to get any dangling items like watches, jewelry, your name badge off so it doesn't get caught in the PPE. Also, if you wear eyeglasses, you might want to secure them with a tie or band so that they don't inadvertently get knocked loose. Hydrate and make sure you go to the restroom before you go into the room. If you have hair that hangs down, make sure it's tied up or pulled up. You don't want it falling into your face while you're in the isolation room, because that's going to cause a problem and possible contamination. You can use a surgical capper or bouffant. That's not mandated here at Mosaic, but if you so choose to do it, you can. Shoe covers are also optional. Before you start putting the PPE on, make sure you do hand hygiene. Inspect your PPE. Make sure that it's not ripped and that it's right size. And as you put it on, especially the paper gowns, make sure they don't rip or tear. The gown, when you put it on, if it's the right size, should fully cover your front and sides of your upper part of your body and go from your neck to your knees. You should be able to extend your arms all the way out without ripping or tearing material. The paper gowns, the yellow ones, do tie at the waist, and then, of course, they have the hole for the head at the top. If you start wearing these blue non-permeable gowns that we're getting in, you'll find there's also a tie at the top. Most of the respirators you'll be using are N95 mask. There are some PAPRs coming into play around the facility for this purpose, and if you haven't used them, you'll get some more training on that. But the N95 mask, the main thing is to check and make sure you've got a nice snug fit. Then eye protection, which you will use if you're wearing an N95, you're going to have to wear goggles or a shield. Goggles, just make sure you got a nice snug fit. The eye shield just has to go above the eyebrows and goes over the mid forehead and then covers your face. When you put gloves on with the yellow gowns, this is a no-brainer because of the thumb holes. You go ahead and you pull them and ensure the exam gloves just cover the cuffs of the gowns. If you have any excess material at the sleeve, you poke it into the cuff. Think ahead. If you've worked in isolation rooms, you know to do this. You get all of your patient materials, all your nursing materials that you don't have in the room. You collect that, whether it's your meds, IVs, lab material, and so on. And then, if you have an observer, or if you don't have an observer, if there's other caregivers that aren't in the room, you want to kind of work out a communication plan with them ahead of time, because you know that no matter how well you plan ahead, you're going to forget something, or something's going to come up after you get in the room. The patient's going to request it. So have a communication plan. It can be as simple as like a homemade whiteboard, but have a way of getting a hold of whoever's outside the room to bring you the stuff, and that way you don't have to don and doff needlessly to get additional items. Also, keep the door closed. That's the only way the negative pressure works. So, if you're in that COVID positive room or going into it, you will have the observer looking at you, and they're going to make sure that you put your PPE on properly, and they're going to have you do a little turning and bending and things like that just to make sure everything's fitting okay. If you don't have an observer, you can simply do this for yourself, and you should do it. Another thing, before you go in that room, think consciously about this. What you don't want to do is be rubbing your eyes or your face or anything like that. It's actually been shown in other case studies where people are going into infectious disease isolation, that's how they usually contaminate themselves. They start rubbing around their face and their eyes and things like that, their mucous membranes. So keep that in mind. If your gloves do become soiled in the room, as long as they're not torn, you can use the disinfectant wipes in the room to clean them off. And also, just remember to perform hygiene, the alcohol-based sanitizer on the gloves while you're in the room in between various tasks. When it's time to come out of the room, before you come out of the room, go ahead and use hand sanitizer on your gloves. We want you to doff outside the room. The reason why is you could doff if you were 6 feet from the patient, but the problem is then you really, really risk contaminating yourself before you get out of the room. So let's plan on doffing outside the room after you use some hand sanitizer on your gloves. Then when you get outside the room, the first thing you kind of want to do is kind of look at yourself and make sure that you don't have any rips or tears, that there's no obvious contamination that's somehow gotten underneath your PPE. Now, if you're coming out of a COVID positive room, you got an observer who's doing that for you. The point is, if you are contaminated under your PPE, whether it's on your scrubs or your skin, you get to take a shower. And then you get to change into new scrubs after you've showered. And by the way, they do, a lot of caregivers right now are keeping an extra set of scrubs at work, but there are some like one-time use scrubs available out of the storeroom. Again, before you start removing your PPE, you want to use hand sanitizer on your gloves. And then you remove your gown, pulling it away from you, not in the violent motion, but just kind of gradually tearing it away from you, putting it into a ball, and then putting it in a trash can. Thing that you're trying not to do is to stir up any aerosols that might be on the PP, and that's why you pull it off, kind of gradually, and that's why you don't really punch it into the trash can, so you don't stir up those aerosols. After you get your gloves off, and your gloves come off after your gown, make sure you do hand hygiene again on your bare hands. Now, here's an exception for removing the N95 or the eye protection, and that's if you're going into another PUI or COVID-19 isolation room right away. Then you can leave those two things on. However, most of the time you're not doing that, so you're going to go ahead and take them off. Uh, what you're trying to do is, say, remove the goggles just by hanging onto the strap, and then you're going to clean it with bleach wipes. And you notice in the picture they put on gloves again before. It's like another set of gloves before they clean them with the bleach wipes. And they let it dry, and then they go into a paper bag for storage with your name on it for future use. If for some reason you contaminated your hands in this entire process, you would perform hand hygiene again. After that, you're going to go ahead and take your N95 mask off by pulling on that lower strap first and getting it up, and then the upper strap. Again, taking it off, trying really not to touch the mask itself, just the straps. It's going to go into a paper bag so it can air dry nicely, and again, it has your name on it. And when you're done with all that, you do hand hygiene again. If you've got that observer because you're working in a COVID positive room, again, they're going to take another opportunity to look you over, make sure you don't have any contamination on your skin and clothing. If a papper was used, put some gloves on again, wipe the papper down with bleach wipes, and then let it dry. By the way, if you have a papper, you're going to have a hood, which is just your hood, and it will have your name on it, and you'll simply reuse it over time. So that's about it. A lot of places use a caregiver log. That's really so that we can track who goes in and out of the rooms, and if infection control needs to do some feedback or follow-up notifications, they can do it. Hydrate yourself, get some rest, get something to eat when you're out of the room, and if you have any questions, call Infection Control 6605. Thank you.